You're listening to the Sass Says podcast. I'm your host, Christy Rocha, also known as Sass. I identify as a woman, a wife, and a mother. That should tell you a lot already. And over the last few years, I've learned the value of talk therapy. I have seen how my inner work not only enhances my own well-being, but also my marriage, my parenting, my relationships. And in fact, you wouldn't be hearing this right now if it weren't for the work I've done. My mission is to debunk the misconceptions and stigmas around what therapy is and who it's for. Let's normalize working on our mental health and seeking help when needed. We've all heard of self-care, self-help, and self-love, but do you often wonder how to actually make it all happen? I do. You'll hear strategy-based conversations with professionals, as well as inspiring and validating stories from women who are just like you and me. Think of this podcast as the weekly therapy sessions you didn't know you needed, with a dash of sass, a lot of vulnerability, and me, relentlessly asking, but how? Hello. All right, my guest today is Dr. Kim Van Dusen. Dr. Kim is a licensed marriage and family therapist, a registered play therapist, university professor, public conference speaker, blogger, and currently works part-time in private practice and also for a clinic that serves families that have children on the autism spectrum. She is a mom of two and the CEO, owner, founder of the Parentologist, a Southern California-based family and lifestyle brand about everything parenting with a therapeutic twist. She has a master's in television broadcasting and marital and family therapy, as well as her doctorate in psychology. She is a writing contributor for many media publications, an official Legoland blogger and Disney content creator, a regular on CBS 8 Morning Local News, and a two-time breast cancer survivor. She is the host of her own podcast called the Parentologist Podcast and is currently in the process of writing her first book. Today, Dr. Kim shares with me her personal hybrid style of parenting, what it means to parent with a therapeutic twist, and how to parent kids differently under the same roof. We talk about mom guilt, burnout, and self-care. She also deep dives play therapy, how it works, the importance of play, and her thoughts on when to bring a therapist into your child's life. This is such an informative episode, and I can't wait. So here's Dr. Kim. Hey, Dr. Kim, thank you so much for being here with me today.
Oh, thank you for having me. I'm glad to be here.
Yes, I'm so happy to connect with you. And I guess we'll just get right started. You are the Parentologist, and I love your tagline, everything parenting with a therapeutic twist.
Yes.
So for someone listening, hearing this for the first time, can you talk a little bit about what that therapeutic twist means and why they should be interested in it?
Yeah, absolutely. When I created the Parentologist, I wanted to be the parenting guru and back when I did start it, 5+ years ago on Instagram, there weren't that many parenting bloggers out there that also had their doctorate in psychology and were a licensed marriage and family therapist and registered play therapist and all the wonderful things that I am. And so I wanted to really bring something to the table that was unique, where I could talk about my own personal experience as a mom and in parenting, and then also throw in that therapeutic twist of my expertise when it comes to, being a child therapist and, thinking about things, whether it's a temper tantrum or potty training or whatever the case may be, on a personal level and a professional level. And so that's where the therapeutic twist comes in. So I do a lot of, everything parenting really when it comes to travel or lifestyle, just anything that parents deal with on a regular basis. And then I also throw in the therapeutic twist because that's what I do. I do therapy for a living. And so I throw in, the mental health component as well and some of my expertise, that comes from my professional side.
So you started this 5 years ago, and that was before I became a parent. So I'm a little newer to all of this. And, the kind of the phrase that I'm seeing around a lot is this gentle parenting. Is that what you would consider your approach to be?
I kind of look at myself as a hybrid, to be honest. There's so many types of parenting perspectives out there. There's a lot of, there's positive parenting, there's gentle parenting, there's this and that. And I kind of feel like I'm a little eclectic. I kind of take from a lot of different types of parenting modalities. And, I kind of created my own, if you will. So, do I do some gentle parenting? Sure. Do I do some positive parenting? Yes. Do I also, do some authoritarian parenting, and do I set limits? And not that you don't when you do the positive or gentle parenting, there's still some, consequences, and there's still, setting limits and things like that. But do I do it in a like a positive way? You know what I mean? So,
Mm-hmm.
so yeah, there's so many different approaches. It kind of reminds me of, sleep training. I used to do a lot of sleep training consultations all around the world, which was great. That's the great thing about Instagram and your website. You can be reached in different countries and across the nation. So I used to do these sleep training seminars and consultations with people everywhere. And the thing that would keep coming up is people would ask me and say, "Are you like a cry it out mom,
Mm.
or professional, or are you more of an attachment mom um, who likes to sleep in the same bed with their child, or do you let them cry it out all night? Like what kind of sleep training are we getting ourselves into?" And I would have the same answer, and I said, I'm kind of in the middle. I don't really maybe identify with the cried out all night type modality, but I also am not fully on board with the attachment parenting. I'm kind of in
Mm-hmm.
the middle. I like teaching kids, self-reliance, self-independence, autonomy, having their own sense of independence, being able to learn how to self-regulate. I think sleep training has a lot to do with regulation too, and making sure that they learn those regulation skills at an early age, even as a baby. But I also don't rush in. Like when I was sleep training my kids, I didn't rush in the second I heard them crying, or they
Mm-hmm.
weren't in my same bed. They did have their own space. Even if they slept in the same room with me when they were first born, they had their own like bassinet or something next to me type thing. And then when they moved on to the crib, I wouldn't run in at every single second they cried, because again, I was trying to teach them that self-regulation and boundaries and things like that. So I was kind of in between, but then of course
Mm-hmm.
I'm a very nurturing, loving, I do a lot on attachment. So I like to bring both into my work, to be honest. And that's kind of how I feel is, when it comes to parenting, I feel like there is no one special recipe to be a parent. There is no one parenting book out there that is going to be the be all end all. I think everyone, based on the own way they were raised, by their own family of origin, or just their personality, temperament, all those things, play a role in how parents parent their kids. And there's not necessarily a right or wrong way. I think we all can adapt and learn different things along the way. And even if you have two kids in the same household, I have two kids, and the way I parent my daughter is very different than the way I parent my son because of their
Mm-hmm.
own personality uniqueness. So it's a very long answer to your question, but like I said, I'm just very eclectic, and I kind of pull from lots of different modalities on how I parent.
Yeah, and as you're talking, I'm thinking about how, in reality, that sounds right to me, in that, you know, you're not gonna, like, when you're actually parenting, you're not looking at a manual for gentle parenting, as an example, and going, okay, step one, step two, step three, step four. So it does make sense that you would pull different methods into the overall picture of what your parenting is going to look like. However, I just know for myself, when you're in it, you want that answer, and you want someone to go, this is what you're supposed to do. So it's hard because
Yeah.
I think that's where the parenting intuition, the gut instinct, has to come into play. And it's hard to trust it in situations that you've never been in before. Like,
Right.
yeah, I don't know, I don't really have a question there. It's just
It
it's yeah,
it's
go ahead.
Yeah, parenting is hard. And I think that's why there's so many different quote unquote parenting experts out there, or there's so many different books that you can read, and there's so much different advice you can get, even from your mom friends, just from their own personal life experience. And,
Mhm.
if something works, I say keep doing it. And if it doesn't, find something else that may work. But like you said, there's no step-by-step manual. Sometimes I wish there was, or that I could write one and be,
Right.
be
Right.
that quote unquote parenting expert. But there isn't. And, that's what makes parenting so hard, but also so unique and nice in the way where you can make mistakes, you can adapt, you can change, okay, that didn't work the first time. Let me try something else now. And then, maybe that works the second time. And that's just the great kind of learning process of it all.
Mhm.
But it can be really hard, and sometimes you
Yeah.
don't know what to do in a situation, and you may not make the right choice. And I always tell my clients, or, friends, and even myself, as a parent, especially a new parent, um, just give yourself grace, because
Yeah.
it's parenting isn't perfect. It's not going to be, and it is going to be hard. There is going to be struggle. There's going to be lots of joy and a lot of great moments too. But to give yourself grace when things don't go the way you thought they would, or to give yourself grace when you maybe should have acted one way and you acted another way, or whatever the case is. Or, if your child's going through a struggle of some kind and you're having trouble trying to figure out how to help them, or whatever the case is. But just, I think parents need to give themselves overall just more grace on all of that.
Yeah, I interviewed Tara Clark. She's the creator of the Modern Mom Probs account, and she said almost verbatim that same thing. I think I asked her what advice she would give her younger self, or what advice
Mm,
she would give newer moms, and she just said, "Give yourself grace. It's going to be okay."
yes. Yes.
It's hard in the moment, but it's always the hindsight, right? You look back. I look back now, even at my first go around with my first baby, and my friend's mom always says the first kid is like the first pancake. It's like a little off, right? Like what you're doing, not the first kid, but like your first experience, right? Like
Right,
it's just
right,
like
right.
you're fumbling through it, and
I
now with my second, it's like, oh, I remember when I was a complete psychopath about whatever this is, and now
right.
I can totally just like chill about it,
Yes. Yes. It's yeah, you learn a lot, and that's okay. And I think just the acceptance, at least a lot of the parents I work with, just finding that acceptance that it's okay to not do it right the first time. Sometimes
Mm-hmm.
you might, and you might, hit a home run out of the ballpark, but if you don't, then just to know that that's okay. Just be aware of it and say, okay, and think about it. What would I have done differently next time? And
Right.
to know that you will survive those hard moments, like you will get through them. And sometimes
Mm-hmm.
you do need to seek help, whether it's with someone like myself, or a parenting book at the store, whatever the case is. Sometimes you do need resources, and to talk to your mom friends and ask, okay, this is the situation I'm in, and to be vulnerable and say, I don't know how to handle this. I even do that myself. And there's some things that I ask, others about, because I want to know how they did it and think, okay, well, maybe I know a good enough way, which is sometimes fine, but maybe they know a better way, or maybe a
Mm-hmm.
different way that might work. And so I just, I say, get as much knowledge as you can to have as many tools in your back pocket as possible.
Yeah. I want to, in speaking of asking for help, I do want to get to that. But before we move kind of on from where we've just been, you mentioned parenting, how you parent your two children differently. And I've heard this before, but can you talk a little bit about at what point, you started to see and figure out that you would need to do that differently, and how you actually make that work? Let's say they're both in the same room, and like, I'm
Right.
just, you know what I'm saying? I'm just picturing like the situation where they're comparing how you're parenting them. I don't know. I could see
Yeah,
that
it's gonna
that
yeah.
overwhelms me, the thought of that.
Well, it's going to be interesting the older they get. So I have a 7-year-old and a 4-year-old. So they're still on the younger side. I mean, they're not
Mm-hmm.
little itty bitties anymore necessarily, but they're still pretty small. So I'm still learning their personalities, and how they're going to grow. And of course, parenting grows with that too. I mean, parenting's always moving. It's like a live being that's always constantly changing and moving. I mean, every single time you feel like you have one life stage conquered, then your child goes into the next life stage, you know, and
Mm-hmm.
especially when you have two, they're both in different stages at the same time. I have an elementary student, I have a preschool student. So they're just, you know, different cognitive levels, different developmental levels. I mean, also all those things. So,
Right.
so it is overwhelming. It is hard to manage sometimes, but you know, my daughter and my son have a lot in common, and they also have some different personality, you know, characteristics. So, you know, with my daughter, I mean, she was super compliant. I mean, she is, when I had her, and she, I mean, literally, when I say she never had a tantrum as a toddler, I'm not kidding. She never
Oh.
had a tantrum as a toddler. I thought I was the best parent in the world. Actually, when I started, it was soon after. I mean, it was just kind of coincidence that I'd started the Parentologist around that time. But I really thought, like, wow, like I am the best parent ever. Like she sleep trained perfectly. She never had a tantrum as a toddler. Like she just, you know, she was social and she had all these wonderful qualities. You know, and anytime like she would do something that would, you know, be a little off, I would say. And if I would get, let's say, upset with her for some, you know, for something she did that, you know, that she did wrong, or, you know, whatever the case was, I would just have to like look at her and she would comply, you know. But my son, my son, you know, beats by his own drum, and he, you know, you know, he's also a second born. I do think birth order has to do with it, personality
Mm-hmm.
differences, possibly even gender, you know, all those things, you know, I think contribute to us being such unique individuals, right? So my second comes along, and I was doing the same type of methods I was doing with my daughter. And I, you know, just, and he was still really good at sleep training. And he was, you know, they were very similar as babies. But then as soon as he got into the toddler phase, and I heard the word no more
The
than I was hearing
dreaded
the word
no.
yes. And I, you know, he was much more stubborn, and, you know, he didn't tantrum as much, but he definitely just was harder in those years. And
Mm-hmm.
I thought, oh, well, I can't just look at him or just quietly say no one time, and everything's going to be fine. You know, I had to use, you know, much different strategies when it came to setting limits, setting boundaries, you know, talking more about consequences and things like that, you know,
Mm-hmm.
of things that he would do that were clearly very different than my daughter. And
And
so,
he's the younger one.
and he's the
Yeah,
younger,
you said second born. Yeah, okay.
yeah. So
Yeah.
he's the younger one. So, you know, he just doesn't listen as well. And people, you know, people say, oh, that's just because he's your second born, or sometimes say it's because he's a boy, or whatever the case, you know, whatever you want to call it. I mean, he just has that different personality, and he just doesn't listen like she did. He doesn't comply like she did. And so, you know, have I struggled more as a parent the second time around? I'm thinking, what happened? Like, what happened to all of my fabulous parenting skills, you know? But he's just different, and he's still a sweetheart, and he's still, you know, a very loving, kind little boy, but he just has a mind of his own, and he doesn't always want to do what you want him to do. And so it's been a little bit different. So that's what I mean of just, you know, sometimes
Okay.
you just do
Yeah.
things differently. You may not, you know, have respond the same way, I suppose.
Mm-hmm. Mm-hmm.
But for the most part, I'm still me. I just respond differently to him than I do with her, because he responds differently to me than she did.
Right.
You know?
Yeah, that makes sense.
Yeah, but you get that mom intuition, you know, and
Mm-hmm.
you know, you probably already have that too with yours, but you just kind of have that mom intuition where you're like, okay, that's not going to work. Like I can't just do this and that's going to happen. You know, it's, you kind of have to just adapt a little bit and just change things, and you know, maybe go back to the books or to the moms and to the, you know, the other resources that you have, and think, okay, well, I need to find a different way to handle the same, it could be the same exact problem, but just a different way to handle it, a different tool in your toolbox, like I said, to try and figure out, you know, how to do things differently with a child. So
Yeah. And you know, as you're talking, I'm thinking that, you know, I didn't intend to bring this up or ask you this, but you know, yeah, there are times where, like you said, you get that mom intuition of, well, this is just isn't going to work this way. And I have to say that throughout the pandemic and the quarantine and with COVID and everything, there have been more occasions than I probably want to admit that I know what I need to do and I'm just feeling too burnt out to do it.
yeah,
And it's honestly the only thing I could think about as you were talking, because
yeah,
and maybe it's just the type of day I'm having with my kids, but like it's just it's
yeah,
so hard because it's all day, it's every day. There's never a day where you can just go, you know what, I don't feel like it today. And unfortunately that's what's happened, but then I feel like crap afterwards because yeah, I know the burnt out method of parenting of just not doing all the things that the books and the psychologists and all the wonderful people that I know and love and talk to tell me to do. I just don't have it in me sometimes.
I feel you. I feel you. And especially after this last year, not
Yeah.
having a second to ourselves to even breathe. And now when you have we're little ones and they're not even have the possibility of even being in school yet. I mean, that's just that life stage anyway. And so there isn't much of a break unless you have help from, let's say, grandparents or nannies or whoever,
Mm-hmm.
even your partner or spouse or whatever, and helping, during those times where you're like, I just need a break, because I just literally can't take anymore. So not only is there that parenting burnout and that feeling, especially over this last year, I know I felt it because both my kids were home, they didn't have a school to go to, and I was literally mom 24/7, and it just catches up with you sometimes. But then
Yeah.
when you get to that point, at least I'll speak for myself. I don't know if you can relate to this, but then I felt guilty for not being the mom that I knew I could be, because
Totally.
of burnout, I was exhausted, I was frustrated, I just, needed some time off, and didn't have it. And then the mom guilt comes in. So then you have this double whammy, coming
Yeah.
at you, and it makes those days really long and really difficult, and those are the days you just gotta take a deep breath, write it out. It's easy. It's easier said than done. I know, but in the moment,
Mm-hmm.
but just say, you know what, today is it might, throw the agenda out the window or just, take some things off your plate and just, I'm going to try again tomorrow. But today that's not going to happen. Today we're just going to sit on the couch and watch Daniel Tiger for 10 hours, popcorn, and we're going to be okay. And that's going to be the best we can do and accept it and, and move on because that's all you can do. Because if not, it can eat you alive.
Yeah.
But it's hard, like I said, it's easier said than done to be in that spot because sometimes you can't put life on hold. You can't just take a day off and say, take everything off my to-do list, I'm just gonna lay on the couch with my kids. That isn't always a possibility, but if you can, that's or sometimes I would just get my kids, as much as I didn't want to and I just was not in the mood, I would just get my kids and get them in the stroller or take them on a walk. Getting some fresh air always recharged me, always reset me into a whole different mindset. Like just that
Mm-hmm.
that that change of scenery, that fresh air, possibly vitamin D, depending on the time of the year. But honestly, I'm not kidding. And even when it comes to like, the witching hour that we talk about when our babies are real little and like around that 4 or 5 o'clock time
Oh
where
yeah.
it's just like, whoa, how much longer is this day going to last? Like, I can't survive another second. I called it the witching hour walk. I would always go out with my kids at that time, and it broke up the day so much. And during quarantine, we would do it a lot. We would do it kind of in the morning around 10ish and then again around 4ish, and we would just get outside, and it always seemed to help.
Yeah.
So I always recommend that to moms. Like if you're in that moment where you're just about to lose your mind and just everything feels wrong, and I always recommend just get outside, even if it's just yourself in the backyard, to just take a few deep breaths and just, just have that change of environment. But if you can actually go physically go on a walk, and, it helps the kids too, because then they get some energy out and all that too. But it really, really works, and it really resets. It's so simple. Sometimes I get stuck where I'm like, I can't even get off the couch, but
Yeah.
if you can get outside, that hands down, it's going to help. It may not change everything or make things 100% again, but if you can change it by 5 or 10%, that's better than where you were 20 minutes ago. So that's what I always recommend.
Yeah, I like what you said there about the 5 or 10% because there are times and just so you know, my kids are 3.5 and 1.5. So there are times where I might be home, on the couch with them or in the playroom or whatever, and yeah, that witching hour, or they just get at each other, and it's like I'm looking at them going, I should take them outside, but my physical body just does not want to move. And it's like, if I, it's almost like just changing the expectation from if I get up and go outside, it'll all be better versus it'll be better than doing this.
Right.
because,
Right.
yeah, because chances are we're going to go outside and it's going to be wonderful for 5 or 10 minutes. And then by the 15-20 minute mark or later, however long I can get out of them, someone's going to have to go to the bathroom.
Yep.
Someone's going to want a snack that I didn't bring. And we're going to lose our minds over the fact that there's a ball that's not ours on someone's lawn. It's
Right.
like,
Right. Yes.
oh,
So yeah, yes, strive for the smaller goals, especially when you're in that mindset or if you're having one of those days, which we all have had. I know I've had them too. Too many to count, and I know what it's like to be there. So, and I know what it's like to even be frozen, like you said, where you're just like, I can't even do that. Like you just literally don't have an inch to give.
yeah.
But set, like I said, even 1%, like just like you said, just know that it'll be better than how you feel like right now. And if it doesn't, at least you gave it a shot. But
Right.
but
Yeah.
guarantee, I mean, I've never had anyone tell me, as of yet, that doesn't help.
Right.
Even if it's just like I said, 1 to 5%, like, okay, just take what you can get. And then, like I said, have that acceptance of, okay, that's the best I could do today, and then tomorrow is going to be a different day. And, and
Mm-hmm.
like those seasons change and those days move on.
Yeah.
But I know what it's
Yeah.
like to feel that. It's hard. It's very hard.
Yeah. Well, and I've been able to better work through those days because I I have a therapist who helps me just
Hmm.
everything. And so given what you do with what is actually parent child therapy? Who is it for? What does it look like? Who's coming to you?
Yeah, well, I see mostly children.
Okay.
So I've seen couples in the past. I've seen families in the past. I used to do a lot of like family therapy where literally the kids, the parents, sometimes the step parents, grandparents, like anyone and everyone would come to see me at once, which was great because it was very systemic and you could work with everybody and have everyone on the same page, which was fantastic.
Hmm.
Um, but now in my private practice and whatnot, I primarily work with children, I would say in the 0 to 10 range, maybe even more specifically in the 0 to 7 range.
Okay.
But I do have a couple kiddos, from the 7 to 10 range, but 0 to 10. And I usually split up my sessions where I spend the first half of the session with the child, doing play therapy. So, we'll be working through, whatever's going on with them, whether it's their parents are going through divorce, whether they're going through some social anxiety or some separation anxiety, being at school. If they're little, maybe they're having some kind of other anxiety or depression, or they just moved or just had a new sibling and they're having some struggle, adjusting to that. Lots of other things. But those are the main things I usually, get called for. And then the second half of the session is usually spent with the parent. And I'll do a lot of parent training during that time. So, and then the kids will, the child will go off and play with the other, spouse or a sibling or something. And then I'll have time really to dedicate with the parent to help them and give them strategies on how to work with their child at home in a different way.
Hmm.
I never like to say in a better way because I feel like, it's just a different way. Sometimes, you just learn, like I said, different tools. Because sometimes as a parent, and I don't know if you can relate to this as well, but as a parent, sometimes you can get very tunnel vision where you just kind of think your own way and think, I've tried everything and nothing works and I'm stuck. And then
Hmm.
someone else comes in and says, well, did you try this? And you're like, oh, no. And that might
Yes.
work.
Yeah.
But sometimes it takes someone else, you know, kind of in a therapeutic way or a loving, caring way, if it's a friend of yours, to say, hey, why don't you try this instead? So, and then sometimes, and then those are how most of my sessions work. But then sometimes I actually have the parent and child together in the same room the whole time. So it depends on their age, what they're going through, like what they're seeing me for and whatnot. But I usually definitely have dedicated time for just the child. Um, and then just the parent. And then, I kind of change things up and have some sessions like with the parent and the child so I can see how they interact together and see, where there might be some holes that we can fill in to make things different and to help make things better, in their lives.
Hmm. So talk to me a little bit about when, as a parent, we we should we should seek this type of help in terms of, you mentioned maybe there's a sibling that they're having trouble adjusting to, or social anxiety or separation anxiety. I mean, those things just as statements tend to happen for most kids at some point. So where's the difference between this is normal behavior, this is a normal phase, you know, versus we might need some extra help here?
Right. That's a great question. And sometimes, I would say, sometimes you don't know till you know. Sometimes you have to actually seek the help and have that conversation to, so someone like myself can know, okay, yes, that's developmentally normal. They'll get through it. Here's a couple of tactics you can try in the meantime to try and, minimize some of the tantrums or whatnot. I see a
Mm-hmm.
lot of kids with ADHD. So some parents are asking me, okay, well, are they just have a lot of energy, or do you think it's ADHD, or do you think,
Mm.
they're having all these tantrums because something else is going on, or is it because of this? So some of it's more parent consultation first,
Mm.
and just having that conversation with someone like myself of saying, okay, here's what I'm dealing with. You know, because a lot of kids I see aren't actually diagnosable, right? So
Mm-hmm.
a lot, not to say that's what you're asking, but just wanted to clarify that a lot of times when people say, "Oh, I go to a therapist or a psychologist or whatever the case may be," it's because their quality, there's something going on with their quality of life. Something is suffering in the sense of they're not eating, they're not sleeping, they're getting in fights at school, their grades are suffering. Like there's some major things going on, and that's usually when I get called, when
Mm-hmm.
it gets to that point, when it kind of gets that bad. And
Okay.
then some parents call me when it's kind of more proactively and preventatively and saying, hey, this is kind of what's going on. Can you just teach them some skills? We're about to have a baby, or we're about to move, or we're going through a divorce. Can you, give them some tools that they can use to, like, coping skills, really, to
Mm-hmm.
deal with some of these things, coming at them. So but those kids aren't necessarily diagnosable. Like, I'm not going to diagnose them with something like a mood disorder or ADHD or anything of the sort. They just need some tips and tools,
Right.
and parents just might need some consultation on some different tactics on how to deal with minimizing temper tantrums, kind of thing, versus them
Mm-hmm.
actually having um, you know a diagnosable behavior that needs to be treated, weekly, on a weekly basis with a therapist. It might just be, here's a couple of tips and tricks. Try them, see if they work. If they do, then we have 2 or 3 sessions and we're done.
Mm. Okay.
So, but I always just tell parents that if like I said, going back to that parent intuition, like if you feel like something's not right and your child's not behaving how they normally behave, or things are just kind of getting a little out of hand, then just call, because it might just need a consultation for, a 1 week or 2 weeks or a month. It doesn't mean it's going to, be long-term care, or, like I said, something that's going to be diagnosable and, has to be treated in that type of level. Sometimes it is,
Right.
but I always say, if whatever the case is, if you just want to know, is this developmentally normal? How are we going to get past this? Do you have any, tips and tricks on how it might make it easier for me to get through it? Then that's something I also do,
Mm-hmm.
and help parents with. So it can be, um, a whole slew of different reasons why and when they come. But I always say just to reach out and ask, because you never know,
Right.
you don't know until you know. So
Right. Right.
that's my.
Yeah. And you'd like to get the help before you're at the point, like you said, where something really major is going on.
Yeah, I do. I think a lot of times people do wait. I think on average, probably most of my clients over the years have waited until things have gotten to the point where it's, I don't want to say out of control, but to the point where, they definitely needed some type of intervention, for one reason or another.
Mm-hmm.
But if you can grab that issue at the beginning, or preemptively, like you said, like if you have a toddler and a new child's coming on board, or if you're going to be moving and your child is in junior high and they had all these friends at their old school and now they're going to go to this new school, and they're going to have a hard transition, or if some things that are coming on, it wouldn't hurt to, to, what was I going to say, to reach out and just talk
Right.
to someone about that, of maybe some strategies that you can use, proactively. But at the same time, um, you know, a lot of times, like I said, it usually takes something bigger for someone to reach out. And I think part of
Right.
with the stigma of therapy,
Mm-hmm.
um, just of, oh, I don't want my child to, feel like something's wrong with them, and that's why we're getting help, kind of thing. I
Yeah.
think we have to break past that first, and that's why people wait, is because that there's still that stigma attached to it.
Yeah, that was exactly what I was about to ask you, like why you think people wait, and I totally agree. I think that it's, oh no, my baby. Nothing's wrong with my baby, like
Exactly.
yeah.
Yeah.
Ugh, it's a
It's
shame.
hard because as a parent, you don't want to see your kids in pain and you don't want to see or feel like anything's, quote unquote wrong with them, and there's not. A lot of times there's
Right.
nothing wrong with them.
Right.
It's just that, and I think a lot of times too as moms, I think it comes from different society messages and things like that, but it's really hard to ask for help. Whether it's even with a family member or a friend. I mean, if you're having a tough time and you need to reach out to someone, it's really hard for anyone, for just humans, to ask others for help. There's something in that of, well, I can't handle it on my own, so I'm weak and have to ask for help. I think there's that kind of, like, again, that stigma attached to, whatever it is. So when it comes to help from a professional therapist, that's like on a whole nother level. If they can't even ask their friend for help to watch the kids for an hour so they can get a break, or even ask their spouse or partner for help,
Right.
if they can't even do that to the people closest to them, then it's going to be really hard for them to reach out to a professional, to ask for help in that state of mind. So,
Yeah.
and then others might feel differently. Others might feel like it might be easier to reach out to a stranger than to someone they know, so it can go both ways. But
Hmm.
either way, you're still asking for help, and that's hard for a lot of people.
Yeah. I think especially when it comes to asking help for your child in that way of, potentially having your child work with a therapist, there is that underlying, well, how did I fail? I'm not enough. I can't get him or her through this on my own. And instinctively that feels terrible, even
Right.
though we really, one individual or two parents or two caregivers cannot be everything to
Right.
kids.
Right. Yeah, that's what they say, it takes a village. I did not understand that term until I became a mom. And I
Yeah.
thought, oh my gosh, it really does, because I really can't do it all,
Yeah.
whether it's teachers or friends or neighbors. There was one time I had to go pick up my daughter from school unexpectedly, and the school called me and said, you have to come to the school right now. And I said, oh no, my son is in the middle of his nap, and I called my next door neighbor and just said, hey, he's sleeping. Here's the monitor. Can you just watch the monitor? He won't wake up by the time I get back, because it was probably going to be 10 minutes tops. But
Right.
if he does, you can go grab him. But, because he knew him well enough. But still, it's kind of weird having your neighbor walk in when you don't expect him to. So I wasn't sure how he'd
Yeah.
react. But, I just said, here's the monitor. And he sat on my front porch and with the monitor. And I ran to the school, got my daughter, was back in like 10 minutes. And he was still asleep, and everything worked out great. But I needed that help. I couldn't. I could have, woken up my son or grabbed him and, cut his nap early and gone. But, I can't be in two places at once. And in that particular case, I needed help. And that's just one random example, but it happens all the time as a parent, where you really do need others, whether it's
Hmm.
having someone, pick your child up from school one day because you have, a work commitment, or, one of your kids has soccer and your other kid has gymnastics, and you just need help sometimes. So,
Right.
um,
Yeah.
anyway, but it definitely takes a village. And I always advocate now. I never used to, because I kind of had that same mentality of, well, if I can't do it all, then something must be wrong with me. And I can't ask for help because I can't let others know that I can't handle it all. And
Hmm.
so I try to do everything myself, and that just didn't work. I just became more run down, more resentful. It was just really hard. So now I definitely advocate to take advantage of that village and
Yeah.
ask for help. And when people say, hey, what can I do, or can I help in any way, take them up on that offer.
Right.
I know
Right.
people maybe don't mean it. They say it just to be nice, or, but really, if people say that, hold them to it, and say, well, you know what, I actually do need your help. Can you do this? And they may still say no, but there's no shame in asking. So
Yeah. Yeah, well, and if they offer and you actually give them something to do, you'll know if they were really meant it or not if they ever offer again.
yes, exactly. And then you may not know. I mean, when I went through a situation a couple years back, and I really needed some friends to kind of step up and help me, I was surprised who came through. And it wasn't the people I thought that would come through. It was
Mm,
people that I maybe didn't even know as well, maybe more acquaintances, that came over and made me a meal, or helped pick my kids up when I couldn't drive, or I had surgery and was going through lots of things. And But the people that I really thought would be there, like my really
Mhm.
close friends, some of them didn't show up at all. And I was really
Mm.
shocked, but I was like, wow, that's, you learn.
Yeah.
You learn. And not say they're not bad people. I mean, I know they had other commitments too, and the timing may not have worked right. It wasn't like they were trying to be mean and not help me. It was just
Right.
interesting that there was people out there that I overlooked, and I didn't see the help when it was there right in front of me, because I was
Mm.
looking in a different direction.
Yeah, and what's also coming to mind for me as you're talking is that I think as our society has shifted, we've gotten really good at the virtual sense of support and community. We all follow a bunch of people on social media. We belong to private Facebook groups where there's all this advice and support and cheerleading going on, especially for moms and women. But we have, I think, at least in my experience, sort of moved away from the in person village and the in person support. And it, like you're saying, like there was a time when it would have been totally normal for you to ask your neighbor to just watch your kid for an
Mm.
hour. I feel like that shift has, the virtual sense of community has been such a blessing and such a great way for someone who's especially like a new mom, young mom, kind of stuck at home or whatever the case may be with their kids to connect and still be in touch with the outside world. But there's people down the street from me that I don't even know,
Yeah.
so
Yeah.
it's hard. Yeah.
It is true, and I have to take inventory on that too, because half of my living is on social media, the other half is in real life, and that's it's
Hmm.
so funny when you say because social media is real life, but it's not real life. I don't really consider it
Right.
life sometimes because it is that virtual reality, and it's that virtual. And I've made lots of real life friends through meeting them on social media and things like that, but.
Hmm.
But it's true. It's sometimes, like I said, things are just right in front of us, and we do live in such a different world now with social media, that it is good to take inventory on that sometimes and realize who's right in front of you, whether it is a new neighbor that you want to go meet, or a new mom you can reach out into your child's class, that during drop off or pickup that you get to know a little bit more, than just the one or two friends that you have. Reach out and broaden your horizons, join new groups, really
Right.
build that mom community, the real life mom community. I think online too is great because sometimes you do just want to kind of escape and, be around people that don't really know you 100%, and that's
Hmm.
okay. So I spend a long time on social media too, and I have lots of, virtual friends, which is great.
Right.
But really build that, in real person, face to face mom community that you can rely on, that live down the street from you, that have the same interests as you or the same interests as your kids, and they go to the same dance class together or whatever the case is.
Yeah.
I really believe in mom communities and having them and building them and really spending time, having that face to face contact, and to have that real life help when you need it.
Yeah. Yeah. And it feels, I know for some listening, because it was me not too long ago where just even talking to someone in person felt uncomfortable. It was
Yes.
like, it's like, oh, hi, and I guess I was given the advice that to just assume the person feels as uncomfortable as you do and ask them how old their kid is, and that's it.
Yeah.
And like
Yeah.
you'll find a connection. Yeah.
It's true, and you have to start somewhere, and it is a little bit awkward. And the last year has made it more awkward because I think everyone's lost some sort of social skills over the last year and a half being in quarantine, and then wearing masks and having you can't even
Hmm.
smile at someone anymore because your smile is covered with a mask, and it's hard
Right.
for people to see your facial expressions and build a relationship in that sense. But it's true. I love that advice. Whoever told you that, about assuming that they're kind of in the same kind of situation as you, to assume
Yeah.
that and, start somewhere, like just, and I actually do that with some parents, even some kids I work with, giving them conversation starters of saying, okay, well,
Hmm.
when you try to make a new friend on the playground, what can you ask them, and
Mm.
they'll write some things down, how old are you? Who's your teacher? What grade are you in? Do you play any sports? Those kind of things, like just,
Hmm.
basic questions when you get to know someone. And I, practice that with my own kids and also my clients that are children. And I think that the same goes for adults sometimes too. Sometimes adults struggle with just even, starting a basic conversation, meeting new people. It's harder to meet people as adults because you don't really have as many opportunities as you did as a kid, per se.
Right.
But to practice those questions, okay, what are a couple of questions I can ask a mom in the pickup line? We're both waiting for our kids, and you say, hey, is your child in this class or this grade, or,
Mm.
and then just get to know them, and then I don't know. They may be your new best friend. You never know, but they
Right.
may it may not go anywhere, and that's okay. And I know some people are more introverted and don't really, want to talk to other people, or, not because they're introverted, but just because of, just their own, let's say social anxiety or whatever. So I know it's not easy for everyone, but for those of you who want to meet more people and build a mom community, and, and meet more moms, I would even suggest, yeah, writing a few questions out, kind of practicing them before you go. And then when you are in line to pick your kids up, or if you're both sitting on the sidelines at a soccer practice, those are some kind of starter questions that you can reach
Hmm.
out and be the first one to initiate. And it might be really beneficial for you.
Yeah. Yeah, that was Ingrid. Ingrid Reed gave me that advice.
Great. Well, it's good.
Yeah. So I can you now. So it jogged my memory a little bit of our. It jogged my memory of 10 minutes ago in our conversation. But as you were talking about, even I like that, giving even your kid ideas of what they can say on the playground and whatnot. Can you you know let's say we are at the point where a parent wants to give their kid some help with you. What are some things that the parents can say to their kid about getting into therapy? How should they approach that with them?
That's a really good question. I'll speak from just a recent experience, and the parent actually offered this to me and said, "This is how I told them that they were going to come see you." A lot of times parents will say, "You know how you have trouble with this, X, Y, and Z. Well, Dr. Kim is going to help you with that, and she's going to support you, and she's going to." Help so you don't have to feel that way anymore, or,
Mm.
behave that way anymore. So whatever the case is, if they're saying, well, how you're having trouble making friends at school, and you're really, shy and scared, and, it's all revolved around, let's say, social anxiety, but they'll say, Dr. Kim is here to help you. So I would just say, I never like to tell parents to tell them that I'm their child's friend, per se. Obviously, I'm an
Mm-hmm.
adult and they're a child, so it's different anyway. But I've had parents sometimes in the past say, "Well, Dr. Kim's your friend and she's going to be there to, this and that." I'm like, "Oh, no, that's, too much, because a friend to a child is very different,
Mm-hmm.
and I don't want to give them the idea that I'm their friend, because I am obviously not, I'm not the same age group. I'm a professional trying to help them. It would blur the boundaries a little bit.
Mm-hmm.
You've seen that with parenting too, where they say, be your child's parent, not your child's friend.
Right.
Even for parenting. And so it's the same thing as a therapist. I'm not their friend, but I do want them to know they can trust me, because I personally believe that good therapy, or effective therapy, only comes from a place of safety and trust. If a child feels safe and is able to trust me, then work is going to be done. They're going to heal from their trauma. They're going to heal from whatever they're going through. They're going to learn how to cope differently, and whatnot. But if a child doesn't resonate with you, like they don't build rapport with you, and they don't trust you, and they don't feel safe with you, then it's not going to go anywhere.
Mm-hmm.
The therapy will fail, not because that person's not a good therapist, and not because that child can't change. It's just the relationship is such an important component of healing, that does need to take place. So I focus the first couple sessions not on the presenting problem. I focus on getting to know that child, getting them to trust me, getting them to feel safe with me, and then we start working on the nitty gritty stuff.
Mm-hmm.
So yeah, so I personally just have parents just say, let them know that, that I can be friends maybe with the parent, or they can say, hey, Dr. Kim is someone that I met. She's really nice. She's going to help you with, X, Y, and Z. And she's going to support you through that. We're all going to be there for you. She has some really great, tips, or whatever the case is. And it's, you can feel safe with her, and, things like that. So that's really just to keep it. A lot of times kids they already kind of know, and a lot of
Hmm.
kids will just say, if they're small enough, they'll just say, okay, because they just know I'm going to play with them and they're just happy with that.
Right.
And as they grow older, they're able to cognitively understand it more of why they're going to see me, and they don't even necessarily need their parents to say too much. Just as long as the parent just explains that we're all there to support that child, and be there, to help them through whatever it is they're going through. So that's pretty much all they need to say, and usually the rest I take care of when I'm in the therapy room. Once they meet me, usually things kind of make sense.
Hmm. And can you give me an idea of what it actually looks like for you and the kid in the therapy room? Like what is play therapy? Like how does it work?
Yeah, I I love this question, and it's so funny because I remember being at a school many many years ago, and a principal walked by and looked in my window, and I'm sitting on the ground playing dolls with one of the students, and he after the student left, he walked in, he said, "Is that what we're paying you for?" He said, we're paying for you to play, and I'm like, yeah.
Yes.
And I even back then I had to explain, what I do, and it's a modality that works. So, I love play therapy because, the they say that Gary Landreth, who's one of the founding kind of people of play therapy, said that play is a child's language and toys are their words. And I couldn't
Mm,
agree more. I feel like that kind of just sums it up, But for any child that doesn't want to talk, there's some kids that just don't want to talk about it. It's too traumatic. They don't want to talk about, the domestic violence they witnessed with their parents, or they don't
mhm,
want to talk about them having to live in two separate homes now because their parents are divorced. They don't want to talk about the bully at school that's been bullying them, and it hurts too much, right? So
mhm.
some kids just don't want to talk. Some kids don't have the language and the speech and language capacity to talk. Some kids I talk to or I meet with have selective mutism, and they've chosen not to talk because their anxiety is so high and they've controlled their body enough where they don't talk in certain situations.
Wow.
So they come to therapy, and there's like for 50 minutes during our session, they don't speak at all. I've had some kids with autism that can't speak, like physically cannot speak. Or I've just had little kids that just don't have the language, toddlers. I've seen kids as early as 2 and 3, and some, like I said, just don't have that language yet to be able to even know the words to talk.
Mhm.
So there's lots of reasons why, kids don't do talk therapy like adults would. So that's where I come in. And so we utilize things like, toys and puppets and sand tray and other, art and other types of kind of playful materials, to have a child open up and work through their trauma through the play, through the play themes that they're going through. So let's say we have a sand tray and they're playing with the little characters in the sand, and they have a theme that they're working on. Let's say it has to do with bullies at school, and they have two characters that are in the sand, and one is being mean to the other one, and then one may bury the other one under the sand. Sounds pretty dramatic, right? But
Mhm.
to a child, they're working that out, and they are utilizing the dolls or the puppets or the action figures or whatever they're playing with, stuffed animals even, to play out a scenario where they're healing their own trauma. Kids know what they need in the sense
Wow.
where I open up that space for them, and I'm there to help guide them if they need it and support them when they need it.
Mhm.
But really, they're the ones doing the work in the room. It depends on kind of what type of play therapist you are. You could be child centered, where really the child leads the entire way, and you just give them, reflective responses and things like that. And then, other play therapists might be more, might interject more, during the sessions
Mhm.
and whatnot. But I've had some kids that wouldn't talk straight to me. I'd only have some kids where they would talk through puppets. There was one little one that I had years ago who was going through a hard time, and I had a little play telephone. And I said, how about you call that person? They were having trouble with a person in their life, in their family. And I said, why don't you call that person and talk to them? Because she didn't want to talk to me. She didn't want to tell me the play by play of what happened and why she was so
Mhm.
upset and whatnot. So she got on my play telephone and she dialed, whatever number she dialed. She was 5. And she called this family member and said, this is why I'm mad at you. And this is why you hurt my feelings. And I overheard the entire conversation. So I knew exactly what was going on. But she
Right.
didn't tell me. She wasn't sitting there talking to me like, Dr. Kim, this is why I'm upset. She was
Yeah.
on the phone talking to this person using a toy to facilitate change.
Yeah.
And like I
It's
said,
amazing.
Yeah, right? It's powerful, and same with puppets. There's sometimes where kids won't tell me things, but I'll get my puppet out and they'll think my puppet's real, and they'll tell my puppet their whole life story. And which, you still use talk therapy sometimes, but you use it through play. You use it in a safe place, where they're still working on coping skills and learning things. And I was just with someone, not too long ago, working on some type of like, again, meeting friends and social anxiety and things like that, and using Barbie dolls to, and the Barbie was having trouble making friends. And so the two Barbies were talking to each other about making friends and what should she do. Okay. And so my client was giving the Barbie advice on what to say and how to make friends to the other Barbie. You know what I mean? So
Mm-hmm.
it's that kind of stuff that happens, and I can go on and on with many examples, but that's the kind of
Mm-hmm.
stuff that happens in the playroom where they're working on something and you utilize the toys and the play to help them get through it, and it's beautiful.
That's really cool.
Yeah.
Yeah. And then the whole this is what we're paying you for comment. Do you find that you have potentially, a set of parents where one is all in and the other one is like, what are we doing here? How do you handle that?
Oh, good question. I really haven't had that, as much. Usually it's always one parent, even if it's a married couple that, again, if it's not like from a divorce situation where I only, work with one parent because that's
Mm,
really the only parent that I have access to. There's some where they all live in the same home and I still only usually have access to one parent. Usually there's always one parent that, um, really is more involved in the therapy than the other parent.
mm-hmm.
And there's sometimes where both parents are involved, and that's great. So, and not to say that the other parent isn't involved or doesn't want to be involved. It could just be, different things with work schedules and whatnot. But if I were to have a parent that was, I would probably just try to softly educate them the same way I just kind of explained it to you, and just, share some examples of kind of what I do,
Mm-hmm.
and how I do it and how it can help their child. And a lot of times when they know that their child is going to get helped and supported and things are going to change into a better way, a lot of times they say, I don't care how you do it, just do your thing. And um, I think the proof's in the pudding, when they start seeing their child changing and they start
Yeah.
seeing improvements in their behavior, improvements in their, mood, all those things, when they actually can see it, they don't even, I don't say care what I'm doing, but they're just like so grateful that things are happening and they actually can see the change and things are better, that they just say, whatever you're doing, just keep doing it.
Yeah.
They don't
Yeah.
even need to understand it per se. They just want to, keep seeing the magic happen. So,
Yeah.
but I've never really had a parent. That one principal, yes, years ago, he just did not get it at all. And which means I probably should be playing with him more, because I feel like, some of my work, now, I mean, hear me out. So some of my work is actually getting parents to learn how to play with their own kids, or just letting go of inhibitions, of play, of being
Yeah.
playful. So in some of my parenting workshops, or in my, university classes I teach with adults and things like that, I have these little snowball fights that I have, and I have they're like little, like, I don't even know what, cotton, I guess, snowballs I got from like the dollar section at Target, and they're
Mm-hmm.
super soft. And anyway, I would bring them out and I would just tell the adults in the room, okay, now have a snowball fight and play with each other. And they would look at me like I'm crazy. And they would be sitting there with their arms crossed and kind of a scowl on their face. And they were just like, no, like that's what kids do. I don't do that, or whatever.
Yeah.
And 5 minutes in, some people would start it, and 5 minutes in, they're all into it and they're all getting competitive. They're ducking, they're trying to get people in the face, like they're smiling and they're laughing. And it's such a beautiful transformation to see these parents who are too cool for school and are like, play's not for me, to letting go and then being playful. That that's what I wish I would have done, a snowball fight with that principal, because once they get how powerful play can be and how healing it can be for kids of all ages and adults,
Mm-hmm.
that, then it clicks. They get it and they say, wow, this is a very powerful modality. And like I said, you may not understand it, but you can appreciate it and know that it's helpful.
Yeah. So having adults understand the power of play, is there anything else that you really wish adults, teachers, parents, whoever knew about kids and knew about what's what's helpful to them, what maybe adults forget or misunderstand, or what would you say, like what do you want people to know about kids, I guess is really what
Yeah,
I'm getting at.
that's a really good question. And I'm glad you asked that because not many people ask that. And I love it. So, I would say let kids be free,
Mm.
when it comes to play, I feel like there's so many restrictions on kids these days, and especially in the sense of, okay, you can play in this room, but then you have to clean it up when you're done, and you're giving so many limits to kids of saying, okay, well, you can't bring toys downstairs because then that makes it a big mess, or don't get too messy outside. You can't play with paints unless you have a smock on, or you can't play in the dirt unless there's so many
Mm.
restrictions put on kids in play where they can't just be. They can't just play and be themselves and let go,
Yeah.
Or someone says, okay, I'm going to set the timer and you can play for 20 minutes and then you're done. I mean, there's so much pressure behind a timer that, just letting kids be free and play, how important that is because it builds communication skills, it builds motor skills, it builds math skills, it builds social skills, it's healing, it helps lessen anxiety, it helps lessen depression. Like there's so many benefits to play. I have blogs about it, so if anyone wants to read more about it, they can just type it in on my website and read more about all the benefits of play. But there are so many mental, emotional, physical, um, um, even I'd like to go as far as saying nutritional. I can go into that in a whole nother podcast. Academic. I mean, there's so many benefits that parents just need to have the opportunities for their child to play and to play uninhibited with all the other limits and restrictions. You know what I mean?
Mm-hmm.
I think that's the biggest thing I wish that I do and wish I could teach more parents, is just letting go of that. And then honestly playing with your child. I know we talked about earlier how sometimes parenting and motherhood can be very, very tiring, and it can be. And sometimes I don't have an ounce left in me to play with my kids. And they'll say, Mommy, play with me, play with me. And, sometimes I have to really just pull it together and get a second winnings for 20 minutes and sit
Yeah.
down on the floor and play with my child. It means the world to them. And I
Yeah.
feel like if I could get more parents to play with their kids, that it's about them and not about the parent, or it's about the child, not about the parent, that you'd see, a lot of parenting attachment styles change because of that extra attachment that comes with playing with their child. So, the benefits the parents get from it too.
Yeah. And I just want to clarify mostly for myself. I think when I sometimes think of, okay, like she wants me to play with her, blah blah blah, it's like I get in my head about, well, I guess my morning shot. It's like, no, actually she might only need me for 15 minutes and then she's
Mm.
off and running, right?
Yep. Yep. Especially when, your kids are little too. And mine's, still fairly small, but their attention span isn't that long. So
Right.
they don't know the time. So you could say it's an hour and it could be 10 minutes. They won't know the difference. Not that you want to, trick your kids,
Right.
but
Right.
they'll say, okay, let's just sit down for 10 minutes. Like you said, that might be enough. And
Yeah.
half the time they don't necessarily even want me to play with them per se. When they were little, they did. I had to actually like speak the other stuffed animal, or, I'd had to be more involved in the play. But a lot
Mm-hmm.
of times they just want me to watch them. So
Right.
you can still be there. It's just about being present with your kids, and it's about putting
Yeah.
your phone away, turning the
Yeah.
TV off, and just having even 10 minutes a day, or a couple times a week. I used to say a half hour a day, but I know sometimes that's a lot, especially when it comes to school and there's not much time in the day, especially as your kids get older. But if your kids are with you full time and they're in the 0 to 3, 0 to 4 range, it can happen more. But
Mm-hmm.
nonetheless, just having some dedicated time daily or weekly to sit down with your kids, like I said, with no other distractions, no phones, no media, and just play or watch your kids play. Sometimes when I'm really tired, my daughter, she's so sweet. She'll say, Mom, do you want to play spa? Or she'll ask me if I want to play. And I'll say, Oh, honey, I'm just so tired. I don't know if I can play right now. And she'll say, Well, do you want to play spa? And I'll say, Okay. So I lay on her bed. She gets I cut some cucumbers for her. She puts cucumbers on my eyes. She brushes my hair. Like, you know what I mean? And
Yeah.
play to her. She's playing spa. Like, she's the spa lady who's, and I'm her patient. And I get to lay there and relax and basically get, self-care time. And she's playing. So
Teach her to pour a glass of wine. You're good to
yeah,
go.
I mean, it works, but you just have to be, and I have, some blog ideas on that too. Like, I think it's something like, playing for the overtired, overworked parent, but I have ideas of how you can play with your kids when you just don't have anything to give,
Oh,
and
I love that.
do
Yeah.
that. So yeah. So just,
I'll find that one and I'll link to that one in the show notes because I'm going to go look it up right now. But
yeah. And I do it by age group too, because I know it can be different at different ages. So I have it separate by age too. Yeah, that'd be great.
Excellent. Well, Dr. Kim, I feel like I could ask you 1,000 more questions, but in the meantime, I and everyone listening can find more from you on your website. Like you just mentioned, your blog. You've also got your podcast, the Parentologist podcast, and I saw in your bio you're writing a book. What are you writing your book about?
Well, hopefully it's the next parenting guru book. Everything we talked about earlier about, parenting advice, but it is going to be basically a toolkit for parents on all sorts of common behaviors, what to do when your child, everything from, a birth until middle school. Basically, I have everything broken down by ages and by different behaviors. So if your child is showing signs of, let's say, anxiety or depression, here's some tools and here's some things you can do to help them. Or if it's, more behaviorally based, if they're having temper tantrums or whatever the case is, I have everything kind of broken down chapter by chapter. So I am in the midst of doing that, and hopefully that'll be published and launched sometime in 2022. 2021 was my goal, but things of, life happens, and that's okay. So, but hopefully in 2022, it'll be the next best parenting book.
I can't wait. If I could pre-order it right now, I would. So when that happens, you let us know. But Dr. Kim, thank you so much for joining me. This was so great. And I think I'm going to hit you up for another one because I have another page full of questions. So
I would love to come back. Thank you so much for having me. I loved our conversation, and I definitely could share more. So I can't wait to come back again sometime.
Where to even begin? I learned so much from Dr. Kim. I'm so appreciative of her willingness to talk about her own parenting and motherhood journey. I know I tend to see mental health professionals on social media and assume it's all sunshine and rainbows, and we all know the truth that professionals are still human. But it is so nice to hear it. Dr. Kim talks of giving ourselves grace and the importance of asking for help, which I don't know about you, but I can't be reminded of enough. And, switching gears to her work, this was the first time I heard real-life examples of how play therapy works. It's fascinating, isn't it? As a mom who struggles to find joy in playing with her kids for any great period of time, yeah, I said it, it was so reassuring to hear the benefits of play. For me, knowing more about the why helps me feel better about doing it. And perhaps you can't relate. Perhaps you love playing with your kids. But for me, after 15 minutes or so, my brain starts to fry. I'm reminded of Renee Rena and Linda Fruits, who speak of this often on their platforms and tend to get a lot of heat for it. We're adults. I don't know why it's looked down upon if we don't find joy in playing pretend with toddlers. Especially because if you've ever played pretend with a toddler, it's often completely unreasonable and illogical. Anyway, I love the idea of a therapeutic twist. I like marrying parenting and therapy. I like knowing the therapeutic benefits of parenting in a certain way. So thank you, Dr. Kim, for doing what you do. I'm looking forward to learning more on your podcast and in reading your book. Thank you for listening. Thank you, Dr. Kim. See you next time. Thank you so much for tuning in today. Sass Says is a production of Luann Nigara, Inc. This podcast is meant to be educational and not meant to replace professional therapy or professional medical attention. To learn more about today's show and what's new in my world, head over to sasssays.com. Thanks so much. Talk later.